call the Committee on Health and Human Services to order. Madam Clerk, roll call, please.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki?
Here.
Commissioner Dobb?
Here.
Commissioner Anderson?
Present.
Commissioner Killeen?
Here.
Chair Baker McCormick?
Here.
Have a
Next
quorum
item.
present.
Okay, thank you. Next item.
B, Chairwoman's remarks.
I would like to say happy holidays to everyone. I think this may be our last meeting of the year as far as HHS is concerned. And I wanted to make sure I wish you happy holidays and happy new year and all that good stuff. Also, I wanted to invite you in January. We're going to have continue our series on building back better, healthier, and wealthier. So that is going to be January 10th, but we should meet before then, but I just wanted you to put that on your radar. And also, redistricting for Wayne County is now in effect. Our maps are finalized. For those of you that didn't know, Wayne County has its own redistricting process. And some of the commissioners, or most of the commissioners, I would say districts have changed, some dramatically like mine and others not so much. But just wanted you to be aware of that. My district in particular, District 6, which is Northwest Detroit, will now extend over into Redford Township. So not only in Northwest Detroit, but it will also include all of Redford Township. So I just wanted to give you an update on redistricting and wish you a happy holiday. Next item, Madam Clerk.
C, approval of the November 23rd, 2021 meeting minutes.
Move approval.
Killeen supports.
Been moved and supported. Any discussion? Any corrections? If none, all those in favor?
Aye.
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 Anyone opposed? All right, motion passed. Next item, please.
E, finished business. There is none listed.
All right, next item.
Item 1, under new business, an update regarding COVID-19.
Thank you. And do we have Ms. Baker here for the update?
Commissioner Baker McCormick, it's Melita Jordan, Director for Health, Human.
Oh, okay, great. How are you?
I'm fine, thank you. How is everybody?
Good.
Good, thank you very much. And thank all of you who extended condolences for the loss of a family member, most recently in my family. So I do appreciate it. Sorry I was not able to be here previously. So it's a pleasure to be back. Thank you. So would like to provide an update on the COVID-19. Over this past week, we had an increase, 6,343 new cases were reported and 2 new deaths identified. The average case per day is 906. That's a 36% increase confirmed cases from the previous week of 11/21 through 11/27, when we had 4,674 new cases that were reported. In addition to that, we've had in the municipalities in terms of, again, where we're having the top 5 municipalities, again, is Dearborn, 669 cases, or 11% of the total cases that I just mentioned, followed by Livonia, 519 cases, or 8% of the total cases, and Canton Township, 511 cases, or 8% of the total cases. Westland, 402, 6% of the total cases. Dearborn Heights, 372 cases, or 6% of the total cases. Our positivity rate is 18.2%. Last week it was 18.3, so we've dropped it just a percentage point. And again, we are still considered high transmission. All of you, I'm sure, have heard in terms of the new variant, the Omicron variant, again, was identified by the World Health Organization on 11/24 and presented in terms of, was identified originally, in South Africa. It is considered and still is being considered a variant of concern by the World Health Organization and the Centers for Disease Control. However, we also know, though, however, in the United States, the Delta variant is still the predominant variant that we're dealing with. In addition, we have 19 states that have been identified with the variant. However, the Omicron variant has not been identified, at least to my knowledge, as of early this afternoon, I just checked, has not been identified in Michigan. However, we do know that in the United States territories, such as Puerto Rico, Guam, and others, it has not been identified in any of the United States territories. However, we do know right across our border here in Canada that we have had an identified case. 2 cases have been identified, and there may be more. However, like I said, to date, we have not been identified here in Michigan. We do know also that there is was conflicting information regarding whether the current vaccines that we have is effective against the Omicron variant. However, current information says that we do not know exactly how much efficacy is being provided by that by the current vaccines, such as Johnson & Johnson, Moderna, and Pfizer against that particular vaccine. Although I'm sure from news accounts you have heard that Moderna as well as Pfizer are in the process of developing an additional vaccine that they believe that will also be effective against it. Still recommending, again, people be boosted as well as get vaccinated. And so we are also continuing to expand our vaccinations sites as well as testing sites. And I have asked the staff to make sure that the website is updated with the current places for not only our vaccinations, but also for where people can be tested. As I had been previously mentioning on each occasion when I speak, I've also talked about the flu. And I bring that up because, again, we are experiencing and recognizing that our hospitals are beginning to have capacity issues because of people presenting with not only COVID, but they also are presenting with the flu as well. And so therefore, we still have capacity available in South Michigan. Our beds are not totally full. There are people that, however, have mentioned that there are long waits in our emergency rooms and our hospital rooms. However, a lot of the wait time is actually due to shortages in terms of medical staff or professional nursing staff. And so we are watching that. I posted earlier today on the website the bed capacity in terms of being able to look that information up. So it is available to the public to determine, even if there are 100 individuals that may be seen in an emergency room or even hospitalized that have a positive COVID test, it does not mean that all of those individuals are in an intensive care unit and or on a respirator. So again, there is bed capacity. There are still ICU beds available. However, I do want to bring to your attention that's important because it allows other individuals who may need to be admitted. There are other diagnoses or capacity to have those individuals admitted as well. So we are monitoring the bed capacity on a daily basis. Okay. Also, we've had 3 new schools that had an outbreak, and 19 schools that we've been following. The staff are continuing to go out and monitor the schools, do site visits, as well as work with the staff at the various schools for mitigation measures. And we are following up on that as well to make sure that we are at the various schools where there have been outbreaks. And so in addition to making sure that we're still distributing masks in the schools and available to anyone that contacts the health department that are seeking child mask and or adult mask, we do have that available as well. So I'll take any questions that you might have.
All right, thank you.
Welcome.
Let's see, any commissioners have any questions? And I will ask the question I asked at our last HHS meeting in reference to if there were any thoughts around alternative care methods, prevention, any discussion on prevention methods as far as just building your immune system?
Sure, we're continuing to make sure, as I said, the various measures that have been in place, public health measures that's been in place, again, social distancing, wearing masks indoors and outdoors, in addition to, making sure people wash their hands frequently. As also, we are working with some of our nursing homes because we recognize that a number of our elderly individuals, a couple of nursing homes had shown positive tests. So therefore, we are making sure mitigation measures are implemented there, thorough cleansing, antiseptic cleansing within the nursing homes, and making sure that we get the individuals vaccinated there as well. So we are certainly out there to make sure that the nursing facilities where people are at are well being taken care of in terms of making sure they get vaccinated, masks and so forth, and working with the staff in terms of providing additional information around prevention. The most effective way to prevent, of course, is to be vaccinated. And although we still have about a 1% breakthrough from those who have been fully vaccinated, however, vaccination is really the method and the methodology at this point in terms of perhaps not getting COVID. And so we do know that the majority of the admissions to hospitals have been with people who are unvaccinated. That's what's driving the rate up. And so we are keeping an eye on that, simply, like I said, trying to make sure that we provide as much information as possible in terms of where people can get vaccinated, as well as wearing a mask, as I said, indoors as well as outdoors.
Thank you.
You're welcome.
Commissioner, I don't know if it was Dobb or Marecki.
Go ahead, Melissa can go.
Thank you. Thank you, Madam Chair. I just wanted to respond to that and thank Director Jordan for her response. I think we really need to be careful with our messaging when it comes to the prevention of COVID-19. Keeping your immune system up or just staying healthy in general, taking vitamins, eating a balanced meal and all that is very important for general health, but it's not going to keep you safe from COVID-19. The best way to not get COVID-19 is to get vaccinated. And then wear a mask, and then also social distance and wash your hands and all of the other stuff below. And I see Carol's turning on her camera, so maybe she wants to join in. But I do think it's dangerous to put the message out there that you can take vitamins and eat fruits and vegetables to help prevent COVID-19, because I really don't believe that helps you not catch this virus. So Carol, do you want to?
I'm sorry, but
Right.
that's not the message
Oh,
that.
And before, yeah, before Carol speaks on that, that wasn't what I was alluding to. In the question that I asked, it was just that we do need to look at keeping our immune system fully up to par, and that is by ensuring that we add to our health regimen other foods and vitamins, and that's really all I was alluding to, not that there's the message that we're saying just take vitamins. So I hope I didn't think I said that, but if you heard wrong, that was wrong. Definitely. So I just want to put that on the record too.
Sure. If I could just speak also, I'm like, that's not what I heard you say, and that's not what I communicated either. So I'm not quite sure how that got inserted into the conversation.
Yeah, I'm not either, but just wanted to make it clear.
Yeah, so Commissioner Dobb, I just want to make sure that you, I think the things that I said were the same things that you repeated. So I just want to make sure that we're on the same page, that there's been nothing else communicated in terms of me and or my staff suggesting that that there were any other alternatives that we were offering at this moment. So I just want to be clear that nothing is being misinterpreted. And so I think I've communicated the mitigation measures, usually your public health mitigation measures in terms of addressing COVID. Again, our goal is to make sure that we can get as many people vaccinated. That is the information that most, again, information is coming from the state health department, as well as the federal government health department and the United States Health and Human Services in terms of public health mitigation strategies is washing hands, social distancing, wearing masks, avoiding crowds. And if so, again, making sure that one does have a mask on indoors, outdoors, is the types of things that I was referring to.
Yes,
Thank
I
you.
understand, Director Jordan, and I was very happy with your response. I just wanted to make sure that we didn't go in a direction because Commissioner Rager-McCormick asked about alternatives. So, and Carol, did you want to join in or?
No, I just realized my camera was off. I was just turning it on for.
Oh, okay. All right, I'm all set. Okay, thank
I
you.
didn't have any additional comments.
Okay, I'm all set. Thank you, everyone. Thank you, Madam Chair.
Thank you.
All right. Commissioner Dobb, I'm sorry, Commissioner Marecki.
Thank you, Madam Chair.
Mhm.
I'm wondering from Carol and from Melita, if anybody is following, you don't hear too much about the antibodies and how protective they are for people that have already had COVID. Two questions. Are people following this? They have to be by now because this has been going on for so long. And what number seems to be protective? I think the antibody test is over 1 and under 1.
Mhm.
So what do they think is a protective number? And how long are they seeing these antibodies? Because I hear people like on the news and stuff saying, oh, it doesn't matter, you still need the booster. But there's a lot of people that are hesitant that have already had COVID that don't want to get it, got vaccinated, got COVID, and don't want to get a booster right now because they have the antibodies. So do you guys have any data on that or anything you can tell me?
I can respond to your question by telling you that there's still uncertainty around that. I think you have different scientists who suggest different things. And so we really don't know the exact amount of immunity that one has after 6 months or 8 months. And so again, we believe it wanes. It has waned over that period of time. And that is another reason why encouraging the booster. But to say that, do we know if a person is 50%, 60%, or 80% have immunity against it at this point? We don't have enough information to sort of know that. So the latest journals that I've read basically supports that. And so, but over time, it is thought that from 6 months ago, when a person perhaps, or 8 months ago, when a person first got the full vaccinations, or fully vaccinated, then there is an opportunity, of course, that it has been decreasing. So the idea around the booster was to increase that so that we could be able to determine or protect you more if you have gotten the booster. So some people are still reluctant because of that. Others have decided to go ahead because they do feel that with the various variants continuing to mutate, and we continue to see more because a variant will continue to replicate it. And so therefore, there are some individuals and some scientists who believe that it was not necessary to do the boosters at all. There are others who believe that, yes, you should. So there is a divided camp on that. So that's where you, again, it's a personal decision in choosing to do or not to do that. Some people have decided that if I do a lot of mitigation measures, such as, like I said, minimizing their contact with other people, wearing a mask, washing their hands, those types of things will prevent them from, again, getting the transmission of it. So I don't have a specific answer.
Oh, I'm sorry.
I'm sorry. I'm just going to say I don't have a specific answer to say how much, but to say to you that there is a difference of an opinion in terms of the various scientists who are looking at this and have done research on this.
And from your research, from their research, do you see anything about certain numbers of antibody, like certain levels of antibodies that they're looking at, that falling below a certain amount may make you more vulnerable and you may need a vaccine? Or is it just that one number, that number one that goes under?
Yeah, I was just going to mention, Commissioner Marucki, I don't have that information in front of me to give you the exact information, but there is data out there on that, and I certainly can have staff look that up and get something back to you.
Okay. And you know what, I can look at it too. I was just being.
I can have staff help provide that information for you, but I just don't have that to be able to comment directly to you and say, this is what that percent looks like.
Yeah, I just think it's an area where it seems to me they've had to be studying this.
Absolutely, and they are.
Yeah, because I mean, there's just a lot of people getting COVID after being vaccinated, and you just want to know what kind of protection you have after you have the COVID and 2 vaccines. So, all right, thank you.
Thank you, Commissioner Marecki. Just another question I had about, or actually someone else asked in the chat that is a good question. Has there been any changes in the mandate that has been provided to schools from the county?
The county has not changed the mask mandate in our schools in Wayne County at all.
Okay, thank you.
You're welcome.
All right, any other questions from commissioners? Any other questions? All right, well, thank you again for attending our meeting and providing the update. We really appreciate you and your time. Thank you so much.
Thank you.
All right. All right, Madam Clerk, we will move to the next item.
Item 2, requesting commission approval of Amendment 1 to a 1-year fiscal year 2022 Local Health Department Comprehensive Grant Agreement with the Michigan Department of Health and Human Services.
Thank you. Is there a motion on this?
Move to approve.
All right, any discussion? Any questions on this item? Commissioner Marecki, your hand is up, or is it still up?
Sorry,
Okay,
it was-
then Vice Chair Commissioner Colleen.
Yeah, thank you, Madam Chair. I'll second the motion, but in looking through the paperwork, it's, this is that annual omnibus grant that we get from the state that we're adding to. I believe that's what it is. Can you be a little more specific than what I saw in the paperwork about what additionally the state is funding us to do under this?
Yes, Carol Osterberry, Public Health Officer and Division Director. And absolutely, one of the monies that is coming through is to provide additional staffing and support for our Healthy Families America program. And what this is doing is it is an expansion for that program, as I said, for staffing, for us to be able to provide services to all of out Wayne County. We currently are limited to only 8 communities. So we are very excited that then we will be able to have this, the program that supports single parents, low-income single parents for, early childhood. It's from pregnancy through age 3 of the child. So that's what the money for the children's, or for the Healthy Families America. The second funding is for the Children's Special Healthcare Services Program. And this is to support a part-time nursing employee who will be able to come in and with our children's special healthcare services clients, specifically for COVID vaccines, but also for any other childhood vaccines that they may need to, get caught up on. That is what is going to be the focus for, this funding, and that employee who we are going to bring on. They will be specifically working with the families, and it would be vaccines, not just for the children's special health care client, but for anyone in the family for the COVID vaccines.
Oh, yeah, thank you. Both of those are real good. The Healthy Families America expansion,
Yes.
can you send us a little something on that program? I don't think I knew it existed. We're talking about single moms, kids under 3. How much are we going to be able to expand with this? What's going to be our capacity? How do we find people to get into the program? Does this also include Detroit residents, or is it all out county?
Out county.
Out county. So I don't know if we know, and I've been involved in programs like this, there's a large need out there. Can you send us the background material on this program? How many people we have on it? How we recruit? Do you want help in recruiting from commissioners? So just some more of the background on it, please, Ms. Osterberry.
Absolutely.
Not today, but if you can send it along, that would be great.
Certainly. We'll get that to you.
Thank you. And thank you, Madam Chair. I have seconded this motion. Thank
you. A quick question that I forgot to ask, Carol, and maybe you can answer this. Are we looking at providing testing kits at all? Have we thought about that at all?
That's a very good question. I know I've seen things about in-home testing kits, and we are more working on the testing, being provided at our community sites rather than the in-home.
Okay.
So if I could add to that, Commissioner
Sure.
Baker.
Thank you.
So yes, there was
Your name and title, please, just so.
Sorry. Melita Jordan, I'm the Director for Department of Health, Human and Veteran Services.
Thank
Just
you.
to respond to the question that you've asked, last week, the Biden administration did mention that they are meeting to put funds into providing for kits to be paid for by insurance companies. It has not been rolled out yet, but states would be receiving funding to do that, and also opening up various sites, family sites, so that people can pick up kits and be able to do them at home. The thought would be that folks would be able to do some self-management in terms of recognizing if they tested, if they were positive. And again, it's not the gold standard. However, it is another preventative measure in terms of having individuals have the kits within their home so they can get tested, and then to be able to get the treatment and so forth that they would need. But the government is planning to provide additional funds for that.
Great, great. Yeah, I think that's an excellent idea because, you know, it might be just a cold, but and then folks are going into the emergency room and causing more of a drain on the system. So, okay, yep, I just wanted to get some clarity on that. Thank you.
Yeah.
All right, so the motion has been made and supported. Roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Killeen,
Aye.
Chair Baker McCormick.
Yes. All right, anyone opposed? All right, motion passed. Next item, please.
Item 3, revision of resolution 2021-626, approving a 2-year contract with 3 one-year options to renew with Black Family Development.
Okay, let's take I think items 3, 4, 5, 6, and 7 together. I think this is just a accounting revision. And that way we can get them all out of the way. Is there any questions about the revision and why we're?
I'll move approval. It's pretty self-explanatory to me, but I'll move
Okay.
approval.
Thank you. Is
Yeah.
there support?
Yeah, and I'll support this. This is the quarterly balancing based on encounter data for all of our 5 CMOs. So I
No, this
support-
is, yeah, this is actually,
Housekeeping, cleaning.
And
Yeah,
Account line
it's just, yeah,
Yeah.
counting
created. Yeah,
movement.
yeah.
And I
Just
don't know,
housekeeping.
can Carol, can you just break it down for us? Or whoever can explain it.
Hi, this is Cecily Hoagland. I'm the administrator in the Juvenile Youth Service Division. And these items are so that we can account for the raise the age in, so we want to amend the resolution so we can add raise the age account number to the CMO's account. So we need to keep track of those dollars separately because they will be reimbursed 100%. And at the time that we had the CMO's contracts approved, the account number wasn't set up at that time.
Thank you.
You're welcome.
All right, any other questions about it? All right, so it's been moved and supported. Can we get a roll call vote?
Moved and supported it.
Colleen.
Colleen moved and Marecki, I believe,
Yep.
supported.
Yep.
Yeah, it was
Other way
Commissioner
around.
Marecki moved and Commissioner Killeen supported.
Oh,
Right.
the other way.
Yeah.
All right.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Did you hear me? Yes.
Commissioner Anderson,
Yes.
Commissioner Killeen,
Aye.
Chair Baker McCormick.
Yes. All right, motion passed. Next item.
Item 8, requesting commission approval of Amendment 2 to a 5-year contract with a 1-year option to renew with Spectrum Juvenile Justice Services.
All right. Can we get someone to speak on this item?
This is Cecily Hoagland, Administrator in the Juvenile Youth Service Division, HHBS. This is amendment number 2 to the Spectrum contract. It's for a 6-month extension. It is, they provide detention beds and treatment beds for the county. And I'll be happy to answer any questions you have regarding the contract.
Okay, and it also has to do with complying with the raise the age?
Well, no, this is an agency where we place kids when if from JDF and also for treatments. So they provide detention beds and also residential treatment beds for youth in Wayne County.
Okay, it indicates that it is to comply with raise the age.
Right, what they do
Right.
have, they can take kids who are over 17.
Okay. Okay. All right, any questions, Commissioner Colleen?
Yeah, thank you, Madam Chair. This is the second time in the meeting the raise the age has come up. Ms. Hoagland, can you give us a thumbnail here on what raise the age is? What is that? And how it affects, because this is only one piece of it, and give us a little idea of how it affects county operations. So what is it and how does it affect our operations?
So the state of Michigan passed legislation that goes into effect October 1st, which raises the age for a juvenile. Prior to the raise age legislation, 17 and under was considered a juvenile. Now 17, as long as you haven't reached the age of 18, so 17-year-olds up until the age of 18 are considered juveniles now. So we anticipate an influx of 17-year-olds come into our system. The state has committed to reimburse the counties, or all the counties in the state, 100% for raise the age kids. Any services that we provide them will be reimbursed at 100% versus the 50% that's with the child care fund. So it's important that we keep track of these expenses separately from our other kids that are in the system. So we've set up different account numbers, and we've made sure that all of our providers can provide services for those kids that are between 17 and 18 years old. And
Okay,
I believe we are like most of this, I think 41 states considers 18-year-olds, some 17, 18-year-olds juveniles, and we were one of the last few states. I think there's 10 states that were considering juveniles at 17. So we raised the legislation, raised it to 18.
So, and thank you for that explanation. So do we know how many are in that cohort that are going to be coming into the juvenile system instead of the adult system? What's the number of kids that are going to be added to the juvenile system one way or another?
Well, there have been some estimates. There was one estimate of like 200 kids coming into the system, but it depends on, I guess, the prosecutor, how they charge kids, what the charge is, because they can still be charged as an adult, depending on the crime that they commit. So we didn't have any kids come through in October. We have a few kids coming through in November who have been designated raise the age kids. So we anticipate somewhere between 100 and 200 kids between now and maybe the end of the year.
And that, of course, will go on year after year. So it's not too much that we're going to overwhelm the system.
Well, we're monitoring the number of kids that come in. So right now we don't see it overwhelming our system yet. So, but we're watching the numbers.
I got you. Thank you very much. Thank you, Madam Chair.
Thank you. Is there oh, looks like Director Jordan.
Yes, I just wanted to add again, Melita Jordan, Director of the Department of Health, Human and Veteran Service. Just wanted to add also to what Cecily has mentioned. Commissioner Killeen, as you well know, oftentimes when we have a juvenile who have bumped up against the criminal justice system or the court system, we don't know, as she mentioned, exactly what those numbers look like. However, a lot of consideration went into trying to determine prior to COVID and now during COVID, what that would look like in terms of the individuals coming in. But as you look at that, you're quite familiar with, the social determinants of health have a tremendous impact on this, meaning that how many of our young people perhaps have dropped out of school and have not finished their high school education, the number of young people that are unemployed, coming from perhaps a single family household and or grew up in a community or a neighborhood that falls into crime and or high rates of crime, and those individuals that perhaps have previously had an interaction with the courts and or the juvenile justice system. All those things are taken into consideration. And also when you look at the ACE scores of some young people in terms of neighborhoods, also will give you an indication of what population and or young people that may actually present themselves to a juvenile justice center and either be part of our system in our JDS system and or on a probation system that we are interacting with. So it does depend on a number of social determinants that will determine what those numbers look like. We will say, as Cecily just mentioned, thus this just became in effect as of October 1st of 2021. So it's very new. We are still adjusting to this, but recognizing that the first couple of years that we do need to keep track of those numbers because of the reimbursement mechanism. And so it may require additional funds from the state. Not sure how much strain is going to put on the county at this particular time. But again, once we are coming probably out of the pandemic and back to more of a normal situation, it may increase the numbers and or because of the pandemic and the social determinants and also the social emotional impact that this has had on individuals certainly do impact young people. And so therefore we may see additional crime occurring within our communities.
Thank you for that again, just to have the picture. And at least with this contract, the state is covering 100% of the cost. I guess you could look at the change in law. I guess you can't really look at it as a state mandate. But how much of our costs, in addition to this contract, has the state committed to covering as we transition kids from the adult system into the juvenile system? Is there other financial help that the state is sending along in addition to this to help with that?
Not to my knowledge, if there's any additional funding coming to help with this, so that we're looking at other opportunities to address prevention, meaning that we are trying to work with our organizations, and so that we can really be out there to provide additional information in terms of prevention and try to make sure that we build up our communities by putting resources into the communities to deter crime, but also to build up our young people and to get them involved in other activities so that, again, it does not necessarily lead to bumping up against, like I said, the juvenile justice system and or the court system. And I know Brian perhaps can add some additional information to that. But again, it is an opportunity for us to make sure that we can do and partner with as many organizations as possible so that we can make sure we give our young people a different avenue in terms of opportunities, so that they are not involved in activities that would lead to a criminal record.
Thank you. Commissioner Colleen, did you have any other questions?
Well, I know Mr. Manning wanted to weigh in on this, so I wanted to hear
Okay.
his take. I mean, in general, this is all good, right? This is going back to when Wayne County took over juvenile services from the state of Michigan at the end of the Engler administration, and how much we have turned around the numbers and how much we have served the youth. And this is just another indication of taking on a little bit of a new with the Raise the Age, but having the same philosophy, and that is to help not adjudicate or incarcerate these kids, but to go down other pathways, which has been extraordinarily successful. So I'm curious as to what Mr. Manning has to add to this project.
Mr. Manning, your name and title, please.
Sure. Thank you. Brian Manning, Assistant County Executive, County Executive's Office. Just wanted to add kind of informationally, there's a couple of fund streams, associated with the Razy Age initiative. The first of which is called it's the Razy Age Fund, and it is probably for items that this honorable body would see at the Public Safety and Judiciary Committee. These would be kind of added costs that county governments and courts have for prosecutorial services, sheriff's deputies, possibly things like indigent defense, other areas that are not involving the child care fund. The second tranche of funding is, and that grant is administered at the state level by MDHHS, and it is granted to circuit courts. So the Third Circuit is the administrator for that pool of funds. On the, as we're calling it, the Raise the Age in the context of HHVS, there's a separate pool of funding which is kind of analogous to the child care fund, meaning treatment services for the care of placed youth. Because of the Headley provision, which means that the state can't theoretically pass through, a mandate that will create additional costs to local government. In this case, because this is moving from something that the Michigan Department of Corrections would have handled prior to the initiation of this law, on 10/1 of 21, to a county and court, area of responsibility. It's funded at 100% rather than 50%. So from an administrative standpoint, we, as always, will bring you a child care fund plan that reflects 50% costs borne by the county / court and 50% by the state. But this grant is a reimbursement of 100% for the 17-year-olds. Now, the way these statutes were enacted, after a period of several years, there's going to be an audit, and there's going to be a weighted average kind of the 100% for the 17-year-olds and the 50% for everybody else. And they're going to come to kind of a blended reimbursement rate. I'll just pull a number out of the air, say it would be 60%. So that's just for context. That's kind of how the flow of funds, and the appropriations work, underneath the policy at the state level. So if that's more than anyone ever wanted to know about that, I apologize.
But it is nice.
That's all I have.
It is nice to see some 100% funding out of the state.
Yeah. It's great.
The oldest game in the book with mandates and who pays for what. So thank you for that, Mr. Manning. Thank you, Madam Chair.
Very welcome. Thank you all.
Thank you, Commissioner Colleen and Mr. Manning. All right, so we need a motion for this item. Is there one?
Move for approval, Anderson.
I'll support.
All right, it's been moved and supported. Roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick,
Yes. All right, motion, anyone opposed? Okay, motion passed. Next item, please.
Item 9 on the addenda. Communication from Carol Osterberry, Health, Human and Veteran Services Department, Public Health Division, forwarding notification of an emergency procurement report for a contract with an option to renew for up to 12 months with Duffy Petrosky and Company.
All right, any questions on this item? It's pretty straightforward, and we look like we have various contractors involved. So is there a motion? Oh, Commissioner Colleen, go right ahead.
Yeah, thank you, Madam Chair, and I will move to approve, but I'm going to ask it here when I saw this on the agenda. We're going to have, is anywhere with this tracking of vaccines, are we keeping track of who is eligible for the booster and contacting them to say it's time for the booster? Or other individuals that maybe only got a first shot but not a second? Are we tracking that, and to encourage those folks who have started down the road of full vaccination but aren't there yet? Does this contract help us with that, or perhaps anything else in the county that we're tracking that?
Yes, Carol Osterberry, Health Officer and Public Health Division Director. And I can tell you through our call center and residents who make appointments through the call center, they follow up with making sure about the second appointment, and then if they're also eligible for boosters. So then our call center, which is staffed through the THAW agency, they are doing those follow-ups with us. This specific contract is this is a receipt and file. This was for the advertising campaign that was run earlier, more in the summer, early fall, on vaccinations, and was countywide.
And this falls under the emergency procurement?
This did, yes.
Yeah. Okay. I'll move to receive and file, Madam Chair.
Thank you. Is there support?
Support Anderson.
It's been
Madam Chair?
moved. Yes. Oh, go right ahead, Commissioner. I'm
so-
sorry.
Oh, no, that's okay. Thank you. So we do not have this contract going at this point. Is that right, Carol?
It is.
Okay, so it's all done?
Yes.
All right, thank you.
Okay, it's been moved and supported. We can do a voice vote. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion passed. Next item.
Item 10, requesting commission approval of Amendment 3 to 2 grant awards, acceptance of 2 grant awards with the U.S. Department of Health and Human Services, Health Resources and Services Administration.
All right. Can we have someone speak to this item, please?
Good afternoon, I'm Tom Coates. I'm trying to get my video working, but it's, as I can see, there I am. Okay. Yes, this is our Integrated Behavioral Health Services grant, which we received here at Wayne County Healthy Communities via Wayne County on August 10th. This is retro back to June 1st. It's to pay for 1 social worker in our Wayne clinic, as well as pay for half of my behavioral case manager here in the Hamtramck clinic.
All right, and so currently, how is your caseload?
The exact amounts are somewhat up from prior year. We still have plenty of room or space. We turn no one away. I don't have my exact volume, but I can share that with the The commission, if they like, or Jennifer Caruso, the Division Director of Clinical Services, can pass that on as well. We see approximately, and this is an approximate number, a little bit over 100 patients a month with behavioral health issues.
All right, and do you have a way that people can call in for help, or is it just strictly walk-in?
No, well, we don't have a crisis hotline at
Okay.
that question. What we do is we turn no one away. We have behavioral health. We service with clinical psychologists as well as the MSW clinical social workers. We have a telemedicine agreement, which is now called Wayne Health, or the old Wayne State University UPG psychiatric group. So they see our patients via telemedicine whenever necessary. That happens once a week. We then provide the support services around that as needed. I hope that answers some of your questions, Commissioner.
Yes, it did. Thank you. And Commissioner Colleen, Vice Chair.
Thank you, Madam Chair. Mr. Cochis, federally qualified health centers, there's some distance between them and a local unit of government. In healthy communities, you have your own board over there that oversees the operation. So how is it that a grant like this doesn't come directly to you? What's the mechanism for how it comes to the county and then the county passes it to you? What's the rules around that?
Okay, well, that's pretty detailed, but the actual federal grant goes to the county of Wayne, and we have signed a cooperative agreement, I think we've discussed in the past, which gives the grant can be given to the county, but the overall oversight of the clinic needs to be done by an independent board, which consists of greater than 50% of people that utilize the clinic. And no one in the clinic, I think I saw TR Winter on here, but no one on the board can have ties to the county itself as part of oversight. These are all Health Resources Services Administration guidelines, and so we try to follow those to the T. So our board members are made up of people that utilize our clinic in some fashion or another, or leaders in the community that sometimes don't utilize the board. I'm limited to the amount of healthcare providers I can have on the board. Only one person that gets most of their income from healthcare can be a board member. So I've taken the opportunity to get an emergency room physician from the DMC. Actually, Harbor Hospital has joined our board, but I do have some retirees that have healthcare background, as well as the rest of our board constituents are all active members of our clinic population.
So it's through this agreement with the county.
That's correct.
That lays out all of the niceties about how to handle this. Okay. All right. Thank you very much, Mr. Cochis. Great job over there. Thank you, Madam Chair.
Thank you, Commissioner Colleen. All right. Are there any other questions? All right. Is there a motion?
Yeah, I'll move approval, Madam Chair.
It's been moved. Is it support?
Support.
Moved and supported. Roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. All right. Anyone opposed?
Thank
All
you,
right.
commissioners. All have a great holiday. Take care.
You too. You too. Motion passed. All right. Okay. Next item, please.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
All right. If you can unmute everyone, and anyone that has a comment, we do not reply to your comment. and you can have 1 minute. Is there anyone that has a comment? Please unmute everyone.
Lines are unmuted.
Okay, thank you.
There's a Shannon with her hand raised.
Okay. Shannon, you could go right ahead.
Yes, good afternoon. I'm Shannon. I live in Wayne County and I'm a medical professional in the community health. And I just have a question regarding the mandates regarding masking. I'm wanting to know if there's any factors and concerns regarding our mental health issues, suicide, depression, and substance abuse, and much more related to the mandates with masking. With our numbers increasing, it doesn't seem like it's really doing anything as slowing down or stopping the spread of COVID. Maybe they're actually increasing the rates of infection. Other states that like us, have tight COVID restrictions, we have higher rates of infection than other states that have no mandates. They've been doing fairly well. And I just wanted to know if we can refer back to the hierarchy of controls, trying to speak fast. PPE is in the least effective, and the more effective is elimination, maybe using the iWave air analyzer in facilities with HVAC systems, updating that. I know one of the school board meetings I was at, they were very concerned with their poor ventilation system with the kids. So I was wondering if that could be a factor to help with the kids to get the mask off, if they can increase and have better air quality in the schools. Thank you.
Thank you. Okay, are there any other, let's see.
There is a Billy Schultz with her hand raised, but how much time are we giving?
1 minute.
Comments? 1 minute.
1 minute. Mm-hmm.
Thank you.
Good afternoon. Okay, for number one,
Yeah.
I noticed a lot of references to about the COVID in the information coming from the media news outlets. I don't think that the health department should be getting their information from the news outlets. Also, regarding to if you don't want to get COVID, get the shot and mask. Well, we just had a huge cruise ship, fully vaccinated. Everybody had to get tested. In order to even leave your room, you had to have a mask on. And it came back with over 10 people that have COVID. Obviously, these vaccines are not working. The masking is not working. And we need to unmask these children in these schools because their mental health depends on it. And we need to do our part on that. We all have our differences and views on what unmasking does, but we need to put it up to us parents and the staff if they want to mask or not. It should not be up to just you guys with your personal opinion on it. You will not mask, that's fine, but you should not push your mask and your vaccines on people that have different beliefs. Thank you.
Thank you. All right. Any other public comments? Madam Clerk, you see anyone else?
No, I don't see any hand raised or anything in the chat. I do have a email to comment.
Okay, yeah, you can go right ahead.
This is from David Dudenhofer. It says, "Greetings, Wayne County servants. By now, I would imagine each of you has received a good number of correspondence from your constituents regarding COVID mandates within the county. Given the fact that this ill-conceived, interventionist response by some Democrats in public service is now falling apart at that seams, and that some of you represent a good number of Black and Hispanic citizens, some 60% of whom have not taken the jab, it is time to end this unlawful madness. Mandates will serve as a pathway to some form of health passport. To put this into terms Democrats understand, passports are medical segregation and will create a two-tier society. What message are we sending to minorities in particular when a few in public service proclaim that ID for voting is discriminatory, but you need a special pass to buy groceries, and the word hypocrisy. And that's the time.
Okay, was that the last email?
Yeah. Yep.
Okay. All right, well, one more. Oh, it looks like there's a Tamara. Sarah Tamara, you can unmute yourself. Can you unmute? Madam Clerk, can you unmute everyone again? Maybe that'll help.
I'm clicking the unmute for Tamara to speak, but I'm not sure if she can hear us or not.
She's saying in the chat she's having unmuting issues.
Okay.
Oh.
Right. Would you like to email us or put it in the chat very quickly?
Madam Chair,
Yes.
Madam Chair, while we wait for Tamara, can I read one additional email that we received?
Sure, go right
It's
ahead.
from Akifa Yakima. We oppose vaccine mandates, mask wearing, creating permanent big weed corporations in Michigan. We require secure feature on our ballots containing watermarks, no experimental vaccines. Carolyn Jackson, and that's it.
All right, and it looks like Tamara just said she was going to email, and then now there's Jill, looks like. Are you there?
Yes, I'm here. Can you hear me?
Okay, yes, we can now.
I'd like
Your
to
full
introduce
name,
myself.
please. Go ahead.
I was about to do that, please.
Okay.
Give me a second. My name is Jill Noon, and I am the Wayne County Chair Chapter of Moms for Liberty. I would like to introduce you to our group and let you know what we are about, since there seems to be some misunderstanding in Wayne County. Moms for Liberty is dedicated to fighting for the survival of America by unifying, educating, and empowering parents to defend their parental rights at all levels of government. What we do: we hold decision makers accountable, or we work to replace them with liberty-minded individuals. We spread awareness and an understanding of the limited role of government. We stand together against government overreach and intimidation tactics. We promote teaching the principles of liberty in our community and our homes. We encourage our communities and elected officials on key issues impacting our families. We activate liberty-minded leaders to serve in elected positions. I wanted to introduce myself. I want you to know Moms for Liberty is not anti-anything. We are pro-choice for parents. Our parents, our children, this health department has way overstepped their bounds. And we would like an opportunity for you to go to our website at momsforliberty.org and find out what we're about. We would like to work with the current health department board. If not, we will have you replaced. That's it.
All right, thank you.
Mm-hmm.
Any other public comments?
Wrong one.
Okay, did we get Tamara's email? She said she was emailing us.
No, I did not. I see her hand is raised, but I did not receive an email.
Okay. Okay, well,
Is she unmuted, Sherelle? Is she trying again?
I pressed the button for her to unmute and I also unmuted everyone, but she's still muted.
That happened to me one time. I don't know why. Sometimes that happens.
Right. Okay, so if you can email us, we can ensure that we read it at our next meeting. Unfortunately, we're not, we haven't received anything yet. All right, next item, please.
Adjournment.
Their motion. All right. Is there support?
Support.
All right. Well, you all have a good rest of your day and happy holidays. Thank you.
You too.
Bye.
Bye.